Hey everyone, welcome back to our channel. Today's topic is incredibly important. We're diving into schizophrenia. It's a complex mental health condition that's often misunderstood, and we're here to shed some light on it. So, what exactly is schizophrenia? Schizophrenia is a chronic mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may have difficulty distinguishing between reality and their own thoughts or perceptions. Symptoms of schizophrenia can include psychosis. This is a loss of touch with reality that can include hallucinations, seeing or hearing things that aren't there, and delusions, false beliefs that a person holds on to even when there is evidence to the contrary. Disorganized thinking and speech. This can make it difficult for people with schizophrenia to communicate clearly or follow a conversation. Disorganized or abnormal motor behavior. This can include things like pacing, restlessness, or bizarre postures. Negative symptoms. These are symptoms that take away from a person's ability to function, such as social withdrawal, apathy, and a lack of motivation. Schizophrenia is a complex disorder that can be caused by a combination of genetic and environmental factors. There is no cure for schizophrenia, but there are effective treatments that can help people manage their symptoms and live productive lives. What is schizophrenia caused by? The exact cause of schizophrenia is still unknown, but research suggests a complex interplay of factors that contribute to it. Here's what we know so far. Genetics. Having a close family member with schizophrenia significantly increases your risk. However, it's not a simple inheritance pattern, and there likely isn't a single gene responsible. Brain development. Early brain development issues, either before birth or in early childhood, might be a factor. Neurotransmitters. Imbalances in brain chemicals like dopamine and glutamate, which are involved in communication between brain cells, are a possible area of investigation. Environmental factors. Certain environmental factors can increase risk, including prenatal exposure to toxins or viruses, complications during birth, heavy cannabis use, particularly in adolescence, extreme stress. It's important to understand that these factors likely interact in different ways for different people. Someone may have a genetic predisposition but never develop schizophrenia if they don't experience certain environmental triggers. What does a person with schizophrenia experience? Schizophrenia affects everyone differently, but there are some common themes in what people experience. It's important to remember that these experiences can be very distressing and frightening. Here's a breakdown of what a person with schizophrenia might go through. Distorted perceptions. Hallucinations. These are seeing or hearing things that aren't there. They can be auditory, hearing voices, visual, seeing things, or involve other senses like smell or taste. Delusions. These are fixed false beliefs that can't be changed by evidence. They can be bizarre, like believing someone is controlling their thoughts, or more relatable, like extreme paranoia. Disorganized thinking. Thought jumbling. This makes it hard to follow a train of thought or have a conversation that flows logically. Someone with schizophrenia might jump from topic to topic or speak in a way that's hard to understand. Changes in behavior. Social withdrawal. People with schizophrenia may withdraw from social interactions because of their symptoms or fear of being judged. Unusual movements. This could include restlessness, pacing, or odd postures. Loss of motivation. Some people with schizophrenia lose interest in activities they used to enjoy and have difficulty taking care of themselves. Emotional impacts. Flattened emotions. People with schizophrenia might have difficulty expressing emotions or seem emotionally withdrawn. Anxiety and depression. These are common co-occurring conditions with schizophrenia. It's important to understand that these are just some of the experiences people with schizophrenia may have. The severity and specific symptoms can vary greatly. What happens if you don't treat schizophrenia? Schizophrenia is a serious mental health condition, and leaving it untreated can have significant consequences. Here's a breakdown of some potential outcomes. Worsening symptoms. Over time, symptoms like hallucinations, delusions, and disorganized thinking may become more severe and frequent. This can make daily life extremely challenging. Reduced quality of life. The impact of schizophrenia can affect a person's ability to work, maintain relationships, and take care of themselves. Social isolation, unemployment, and financial difficulties are common. Increased risk of substance abuse. People with untreated schizophrenia may turn to alcohol or drugs to self-medicate or cope with their symptoms. This can lead to addiction and further health problems. Suicidal thoughts and behaviors. Schizophrenia is a major risk factor for suicide, especially during periods when symptoms worsen. Early intervention and treatment are crucial. Physical health problems. People with schizophrenia may neglect their physical health due to their mental state. This can increase the risk of conditions like diabetes, heart disease, and obesity. Legal problems. In some cases, untreated schizophrenia can lead to behavior that results in legal trouble. How long can a person survive schizophrenia? Schizophrenia itself isn't directly fatal, but it can impact a person's lifespan. Here's what you need to know. Reduced life expectancy. Studies suggest people with schizophrenia have a life expectancy 10-20 years shorter than the general population. Underlying causes. This shortened lifespan is due to several factors associated with schizophrenia, such as physical health neglect. People with schizophrenia may struggle to maintain healthy habits or access medical care, leading to higher risks of health problems like heart disease and diabetes. Suicide. Schizophrenia is a major risk factor for suicide, especially during episodes with severe symptoms. Substance abuse. Self-medication with drugs or alcohol can worsen health problems and increase risky behaviors. Importance of treatment. Early intervention and effective treatment can significantly improve a person's quality of life and chances of living a longer lifespan. Treatment can help manage symptoms, reduce the risk of suicide and substance abuse, and encourage healthy habits. It's important to remember, these are averages, and individual experiences can vary. With proper treatment and support, people with schizophrenia can live fulfilling lives well into their later years. How to deal with someone with schizophrenia. Here are some tips for dealing with someone with schizophrenia. Educate yourself. Learning about schizophrenia can help you understand their experiences and how best to support them. Reliable sources include the National Institute of Mental Health NIMH and the Schizophrenia and Related Disorders Alliance of America SARDAA. Communicate with empathy. Listen attentively and try to see things from their perspective. Validate their feelings and avoid arguing about the reality of their hallucinations or delusions. Focus on feelings. It can be more helpful to acknowledge their emotional state than the content of their delusions. For example, you could say, "It sounds like you're feeling scared right now. Can I help you somehow?" Be patient and supportive. Schizophrenia is a lifelong condition, and there will be good days and bad days. Be patient with their progress and offer support in their recovery process. Encourage treatment. Medication and therapy are essential for managing schizophrenia. Encourage them to see their doctor and therapist regularly, and offer to help them with appointments if needed. Set boundaries. While it's important to be supportive, it's also okay to set boundaries. You can't control their behavior, but you can control how you respond to it. Take care of yourself. Dealing with someone with schizophrenia can be emotionally draining. Make sure to prioritize your own well-being and seek support from friends, family, or a therapist. Here are some resources for caregivers of people with schizophrenia. The National Alliance on Mental Illness, NAMI.org, offers support groups and educational programs. The National Alliance on Mental Illness Family Support Group Network, NAMI.org, connects you with others who understand. Remember, you can't fix schizophrenia, but you can be a supportive and understanding presence in their life. It's a chronic brain disorder that affects how a person thinks, feels, and behaves. Contrary to popular belief, it's not the same as having multiple personalities. Instead, it involves a range of symptoms, including hallucinations, delusions, disorganized thinking, and impaired social functioning. Let's tackle some common myths about schizophrenia. Myth: people with schizophrenia are violent. Thank you for joining me on this journey to learn more about schizophrenia. Remember, education, empathy, and support are powerful tools in the fight against stigma. Together, we can create a world where everyone feels understood and accepted, regardless of their mental health condition. Until next time, take care.